So I just wanted to kind of tell you guys, for those of you who have been following my ACL reconstruction surgery recovery, I am having surgery again next month. I've been having the same pain for a long time, since probably like 2 months post-op, but I obviously didn't want to jump to conclusions because I just had the surgery, and you know, I've never had it before, so I didn't know what to expect. But as someone who works out, and I'm very aware of my body, you know, and through jiu-jitsu that's really helped, I knew that something didn't feel right. It felt off. It just like, okay, I still can't do all these simple things. A lot of people that had their surgery around the same time I did, they were progressing much faster. And I know that everyone's different, and my surgery was a little bit more complicated. But I mean, it was like 3 months after what they're doing, I'm still not doing the things that they're doing. And I'm like, this doesn't feel right. Like, and I'm dedicated. I'm very dedicated to my working out. I'm very, to my rehab. I was on top of everything that I should have been doing or not doing. I was on top of it, and I still like wasn't seeing any progress. And even still to this day, you know, I'm still having that excruciating pain, you know, during these like certain movements or even walking. Like, I can't just like squat down, and it's just really a burden to me. So that's why I've kind of decided to look further into it. I'm getting it done by a different surgeon. Hopefully he'll be able to help me. He's kind of on the fence about everything. He's sort of like 50-50. He doesn't know if what's wrong can be fixed. He hopes that he can, you know, alleviate a little bit of the pain by just like going in there and, you know, cleaning things out and stuff. But he won't really know how bad the tendon looks until he gets in there to look at it. The problem I'm having is with my patellar tendon. So he won't know until he looks, and I won't know until I wake up, which kind of sucks. Like, I'll have an idea of how long my recovery will be when the surgery is done, because if he does have to repair anything, he said that I will be in an immobilizer again, which I am just really not looking forward to. I don't want to deal with the whole muscle atrophy thing again, but I'm hoping that just by going through this, it will help me. It will make me feel better, so that I can eventually squat and do all the things that I need to do in order to make my leg muscle grow to be normal again. I am back to training jiu-jitsu. Coming back, I was pleasantly surprised at how much information I was able to retain, and I feel like that had a lot to do with, even when I was out for a full year, so I was still at the academy watching 2 to 3 times a week, and that gives you a different perspective. It really kept my mind engaged, and I was doing a lot of visualizing, and, you know, watching. I was almost feeling like I was doing it myself, and so I feel like that's what helped me keep the little information that I learned. So that was a huge help. So I definitely recommend that. If you get hurt, still go to the academy and still watch, because it really does help, even though you think it's not. You know, it hurts your heart a little bit, but you'll be fine, and it definitely helps. You know, I still have my training is still very modified, and but other than that, I'm pretty happy, all things considered. I can't really complain too much. I'm able to be on the mat, and that's just like, it feels really good to me. So hopefully I can be back. I won't be out for a full year. I'm hoping at the most 6 months, if for some reason it's pretty bad. That's like worst case scenario, I'm hoping. So, but the day of my surgery, I'm probably going to do a little like vlog thing, like before and after, just so anyone that's about to go through what I'm going through or whatever, so you can just be like terrified. I'm just kidding. But yeah, so I'm going to do that, and I don't know. Well, we'll see, and I'll see you guys in the next video. Peace.